we are going to discuss the group of oral hypoglycemic agent known as thiazolidinedione or PPAR gamma agonist, or we can say simply as glitazones. There are three drugs in glitazones: troglitazone, TRP is the mnemonic, troglitazone, rosiglitazone, or pioglitazone, out of which only pioglitazone is currently being used. Troglitazone caused hepatotoxicity and was withdrawn. Rosiglitazone increased the risk of myocardial infarction, CHF, stroke, and death. It was also withdrawn. Okay. And after these cardiovascular side effects of rosiglitazone, the cardiovascular outcome trials have started. Okay. Now the mechanism of action, it is a PPAR gamma agonist. So it's a selective agonist for PPAR gamma. What is PPAR gamma? Peroxisome proliferator activated receptor. Peroxisome proliferator activated receptor gamma, which is present mainly in the fat cells, but also present. PPAR gamma is majorly present in the fat cell, but also in the muscles and some other tissues. Okay, so it is the agonist of PPAR gamma. Now, what is the actions? It stimulates the PPAR gamma. It causes the transcription of several insulin responsive genes. तो इंसुलिन रिस्पॉन्सिव जीन्स का एक्सप्रेशन को इट इंक्रीजेस द ट्रांसक्रिप्शन. तो इंसुलिन रिस्पॉन्सिव जीन्स को एक्सप्रेशन बढ़ा देता है बाय एक्टिवेटिंग दिस पीपीआर गामा रिसेप्टर्स. तो ये दिस द मेजर एक्शन. इट रिवर्सेस द इंसुलिन रेजिस्टेंस. तो कैसे करता है? और ये क्या अभी हमने पढ़ा, ट्रांसक्रिप्शन ऑफ इंसुलिन रिस्पॉन्सिव जीन्स बढ़ जाएगा तो इंसुलिन रेजिस्टेंस कम हो जाएगा एंड इट इंक्रीजेस द GLUT4 एक्सप्रेशन एंड ट्रांसलोकेशन. उनका एक्सप्रेशन बढ़ जाएगा, ट्रांसलोकेशन बढ़ जाएगा, तो ग्लूकोज एंट्री टू द मसल एंड फैट इज इम्प्रूव्ड. At the level of the liver, it decreases hepatic gluconeogenesis as done by every oral hypoglycemic agent. Now, at the level of the fatty tissue, what it does? It decreases the lipolysis and decreases the plasma fatty acid level. तो lipolysis कम कर देगा, accelerate adipocyte turnover and differentiation. ठीक है, एंड लोअर्स दी HbA1c, इंसुलिन लेवल भी लोअर कर देगा, ट्राइग्लिसराइड कम, HDL इंक्रीज, बट LDL पे नो सिग्निफिकेंट चेंज. वाई? बिकॉज PPAR गामा को जब हम स्टिमुलेट करते हैं, इट इंड्यूसेस द एक्सप्रेशन ऑफ रिवर्स कोलेस्ट्रॉल ट्रांसपोर्ट एंड सम एपोप्रोटीन्स. सो इफ यू लुक एट द लिपिड प्रोफाइल, द लिपिड प्रोफाइल इज इम्प्रूव्ड. LDL में कोई चेंज नहीं है, बट ट्राइग्लिसराइड को रिड्यूस कर रहा है और HDL लेवल को इम्प्रूव कर रहा है. दिस इज बिकॉज कि रिवर्स कोलेस्ट्रॉल ट्रांसपोर्ट मैकेनिज्म इम्प्रूव हो गया है, बिकॉज इट इंड्यूसेस द एक्सप्रेशन ऑफ रिवर्स कोलेस्ट्रॉल ट्रांसपोर्ट मैकेनिज्म एंड सम एपोप्रोटीन. और फैटी टिश्यू में लाइपोलिसिस भी कम हो रहा है, फैटी एसिड्स भी कम बनेंगे. ठीक है, एडिपोसाइट टर्नओवर भी इंप्रूव होगा, डिफरेंशिएशन ऑफ एडिपोसाइट भी एक्सेलरेट होगा. सो दीज आर द एक्शंस. And majorly हमें what we need to remember is the decreased insulin resistance and the lipid profile at the hepatic gluconeogenesis, reduced hepatic gluconeogenesis. Now the side effect is sodium and water retention. It causes sodium and water retention, leading to plasma volume expansion, and the associated side effect: edema, weight gain, headache, myalgia, even mild anemia. Okay, hepatic dysfunction it causes. Therefore, you need to monitor LFT, very important, and very very important. CHF may be precipitated, and that is why it is contraindicated in both of these things: liver diseases as well as CHF. Minor increased risk of minor side effects, increased risk of fractures, especially in elderly women. Now, iski metabolism occurs using cytochrome enzymes, specifically CYP2C8 and CYP3A4. Therefore, failure of OCPs occurs during pioglitazone therapy. Now, ketoconazole and rifampicin has interactions. Ketoconazole inhibits the metabolism while rifampicin induces the metabolism of pioglitazones. Pioglitazone के साथ there is a blue box warning, that is it increases the incidence of urinary bladder carcinoma, and it was withdrawn also, but it was reintroduced the very next day because the incidence of the carcinoma is very less and there is no drug to replace it. Okay. Now in type 2 diabetes mellitus, it is used. It is not used in type 1 diabetes mellitus. Now indication में it supplements the sulfonylurea or metformin, and in case of insulin resistance, and can also be given as monotherapy in mild cases. Not used in pregnancy. Glitazones advantages: it has the potential to delay the progression of pre-diabetes to overt diabetes mellitus. Okay, and it helps to conserve the beta cell function. Because of this, it could be used to prevent the progression. Okay, and this is all about glitazones. Thank you.